Assalamu alaikum. Inferior alveolar nerve injury due to the extrusion of calcium hydroxide during endodontic treatment. This case report was published by Kasapoglu in the Australian Endodontic Journal in 2022. As we know, calcium hydroxide is one of the most commonly used materials in root canal treatment, and even though it's considered to be safe, it may have some degree of neurotoxicity if it comes into direct contact with the nerve. So during root canal treatment of the posterior mandibular teeth, filling material or irrigation solutions may be accidentally passed beyond the root tips into the mandibular nerve canal, especially if the root tips are in close proximity to the canal itself. So this extrusion may cause nerve injury by mechanical compression, chemical toxicity, or thermal injury. And approximately 8% of inferior alveolar nerve injuries are related to endodontic treatment. So in this case, a 32-year-old old man presented into the oral and maxillofacial surgery clinic with a chief complaint of persistent numbness on the left lower jaw. And he mentioned that symptoms began immediately after root canal treatment was performed on the lower left second molar, and the numbness had persisted for 3 weeks. Radiographic and CBCT imaging was done, and as you can see in this panoramic radiograph, there's an endodontic material which is extruded through the root apex, and the material is entering the inferior alveolar nerve canal, and also has spread into the surrounding bone. Neurological examination showed that the patient had reduced sensation, also numbness of the lower lip, chin, and the buccal gingiva around the premolars and the molars. They also did a two-point discrimination testing on the face of the patient, which measures the distance between 2 points where the patient can feel touch. On the normal side, the distance was 6 millimeter, and on the injured side, it was 18 millimeter, which indicates marked sensory impairment on that side. So the previous dentist was contacted, and he mentioned that he used a step back technique in this case, and he filled the canals with Vitapex, which caused the extrusion above or beyond the root tips. And the patient mentioned that he had felt a sudden severe pain while the root canal was being filled, and the pain continued after the local anesthetic wore off. So the treatment options were discussed with the patient, and he was given two choices. The first one was to do a surgical debridement for the area to remove the material from around the nerve. And it was said or mentioned to the patient that even though this option is valid, it may cause further damage to the nerve itself. The second option was conservative management, which was to wait for the Vitapex to naturally resorb and to monitor the healing process over time. The patient chose the non-surgical treatment, and the clinicians opened the root canal, performed decompression, and monitored the patient with periodic radiographs. The 2-month follow-up radiograph shows significant resorption of the extruded material. However, the patient still had a certain amount of numbness in the area, and the patient was followed up further. And at the 6-month follow-up, we can see that the Vitapex had completely disappeared, and the patient mentioned that numbness had improved considerably, and the two-point discrimination test had been done again, where it improved from the initial 18 millimeter to 10 millimeter. However, at this point, the tooth couldn't be treated, and it was extracted. And after 3 years and the follow-up appointment, it showed that the patient had completely recovered with no remaining numbness, and the patient also reported normal sensation. So the mechanism of the nerve damage by calcium hydroxide can be explained by causing inflammation, producing foreign body reactions, as well as causing bone necrosis and blocking the nerve conduction of the nerve. The authors also described that recovery is not expected in all cases. However, the reasons that they believe that recovery occurred in this case was due to the relatively quick resorption of Vitapix compared to some other endodontic materials. And as the material disappeared, the pressure and the chemical irritation on the nerve gradually also resolved. And the treatment of such cases should be based on the material used, severity of the symptoms, and the imaging findings of the case, and whether the symptoms improve or worsen over time. So sometimes surgery might be the primary treatment, and other cases, such in this, we can wait to see for improvement of symptoms and resolution of the numbness. And in conclusion, even though the extrusion of calcium hydroxide into the mandibular canal is a rare complication, but it is a serious one, and as it can cause numbness, pain, and altered sensation for a prolonged or could even be not reversible. So we should always take good radiographs to assess the proximity of the canal to the posterior mandibular teeth, and we should avoid excessive pressure when injecting any type of materials into the canals, and also using an electronic apex locator in order to prevent the over extrusion or over instrumentation of the canals. Thank you.